Hi everyone, welcome to our heart surgery discharge class. My name is Amy and I'm one of the nurses here at the Heart Institute. We hope this video will be useful to you on your journey of recovery after having your heart surgery. This class will provide you the information you, your family, and your caregivers need to guide your recovery after your heart surgery. Whether you've had a bypass surgery, a valve repair, or replacement surgery, or a similar surgery, this information will help reduce your risks. Research has shown that these steps can really help improve your recovery. We hope that your loved one who is staying with you after your heart surgery is watching this with you, because we'll be sharing some very important information. If they can't watch it with you now, they can watch it at a different time. Having a loved one listen to your healthcare education can also help improve your outcomes and even possibly decrease your readmission risk. Together, this video, the Recovering from Surgery Discharge Guide, and the discharge tools you will receive, as well as ongoing discussions with your healthcare team, will give you and your caregiver the information you need to take the next steps in your recovery. It is important that you and your loved one attend the virtual discharge class before you leave the hospital or soon afterwards. The virtual class will give you an opportunity to ask questions if there is anything you want to understand that isn't covered in this video or in the other information you'll receive. Information on how to attend the class is located on the Heart Institute website calendar. You can call into the live virtual class using your phone if you're not able to join online. The information on how to attend will also be on the after visit summary paperwork that you'll be given on the day of your discharge. The University of Ottawa Heart Institute staff have worked closely with the Heart Institute patient alumni to develop this video, so we want to thank them. Your healing process will begin right after surgery. Taking care of yourself after discharge, attending your follow-up appointments with your healthcare team, and participating in rehabilitation are all aspects of healing and will reduce your future risk. The length of your hospital stay will depend on the way your cardiac surgery is performed. If there is an incision along the middle of the chest, a sternotomy incision, the average length of stay is about 4 to 5 days, not including the day of surgery. If it is done through a minimally invasive incision on the left or right side of your chest or underneath your pec or your breast area, between the ribs, a thoracotomy, the average length of stay is about 2 to 3 days, not including the day of surgery. You may need to stay a little bit longer. For example, if your heart rate needs to be monitored. No matter the length of your stay, on discharge, you will be given a prescription for your medications that you will need to have filled at your pharmacy on your way home.
Hello, my name is Suad Al-Mansouri. I'm a social worker at the Heart Institute. You will need someone to stay with you for most of the day and most of the night for at least 1 to 2 weeks after your surgery. If your surgery is unexpected and you live alone, staying somewhere with extra support temporarily, like a friend or family house, might be a good option. Part of the reason for this is you will need someone to drive you to medical appointments, to help you with groceries and meal preparation, for example. The other reason would be, should you run into trouble, then this person could call for help for you. Some patients opt for convalescent care, and Heart Institute social worker will be happy to assist you with that.
If there is an emergency after you are discharged, do not delay in seeking help. Even though emergencies are rare, if something does happen, you need to call 911 and/or go to the nearest emergency department. Examples of an emergency would be sudden weakness on one side, sudden change in vision, slurred speech, or any signs and symptoms of a stroke, or sudden difficulty in breathing, at rest and feeling unwell, or sudden and severe chest pain and feeling unwell. If something is worse after you leave the hospital, but it is not an emergency, you need to call your surgeon's office or the nursing coordinator to review that day. Examples of when to call would be any signs and symptoms of infection at any of your incision sites, or any new or increased shortness of breath. You can call your surgeon's office during working hours. If it is off hours or the surgeon's office is closed, you can call the nursing coordinator anytime, day or night, at 613-696-7000, extension 0. We most likely will not call you back immediately, but we should call you back that day. Both of these contact numbers are on the very first page of your Recovering from Surgery patient guide. Keeping your incision clean and dry after your surgery is very important. You should examine your incisions before leaving the hospital. You should also examine your incisions every day after you leave the hospital. You could also ask a family member or caregiver to do this for you, or you could take a photo. This way, you'll know if the incision is healing properly after you leave. If it looks worse than after you leave the hospital, you will need to contact us as soon as you notice it looking worse. Most patients go home without a bandage on their incisions, so they are just left open to the air. Be careful not to touch your incision or scrub it. The scab is like a natural bandage, and it will help the incision heal. Keep the incisions clean and dry and free of debris or rubbing. Do not apply any creams, oils, powders, or lotions. They can increase the risk for infection. If you require a dressing change on one of your incisions after you leave the hospital, we will organize that for you at home. If there is a nurse in the community doing your dressing at home, be sure to examine your incision when the dressing is changed. It's still important that you contact us at the Heart Institute if there's any worsening with any of your incisions. If you've had an incision on one of your legs, swelling on that side of your leg is expected and may continue for a few weeks. To reduce the swelling, you can keep your leg elevated while you're in a sitting position and avoid crossing your legs. You can use the Cardiac Surgery Management Zone stoplight tool to help you know what is normal or not so normal with your incisions. If you're in the green zone, continue as is. Ensure that your incisions are clean and dry. It's normal to feel some pulling, burning, or numbness near the incision site. It's also normal for there to be a little notch at the top of the sternum if you have a sternal incision. This will take about a month or two to come down. Again, don't apply any oils, creams, or lotions to any of your incisions. If you've been home for a week or so and something changes and you notice you've moved into the yellow zone, maybe you notice there's more redness or any new drainage, or you feel an increase in pain, please call us that day. Do not wait. This can help decrease your risk for infection. If you're in the red zone and you notice any of the following, the incision is open or it's gaping, there's any creamy or pus-like drainage, bad odors, a fever, which is 38 degrees Celsius or higher, these are all signs of a possible infection. If you see any of these signs, please call us that day so you can call your surgeon's office or the nursing coordinator. We most likely will arrange to see you in person that day or the next business day in our clinic if an infection is suspected. To keep your incision clean and dry, you should have a shower once a day or once every second day. Have someone nearby the first few times you will have a shower at home. It will be physically demanding and you might need some help. Keep your shower short and make sure the water isn't too hot. The pressure of the water may be uncomfortable on your incision, so avoid allowing it to fall directly on that location. Use a gentle soap to wash your body as usual. The water and soap may roll over your incision, but don't scrub off the scab. When you are done, gently pat the incision dry with a clean towel and launder that towel after each use. You will likely need to rest for a while after your shower for the first few weeks. It will be like doing an exercise, and you may feel tired. If you have a bandage on your incision, you can coordinate your shower with your home care nurse. Never leave a wet bandage on an incision. Don't have a swim, bath, or go into a hot tub for about 8 weeks after your surgery. By then, you should be totally healed. Anyone with a sternal incision and a C-cup or higher breast size should wear a soft bra that closes in the front if possible. It should be comfortable, yet supportive. Wear it most of the day and most of the night to help prevent the extra pull of the breast tissue on the incision and sternum. This can help promote healing and also possibly decrease your risk for infection and maybe even decrease your pain. If needed, you can use a clean gauze pad changed daily to protect your incision scab and ensure there is no rubbing or irritation by your bra at the bottom. Also, you can use clean gauze to wick away any moisture in between your breasts to ensure the incision stays clean and dry. If you have an incision down the middle of your chest called a sternotomy, you must also protect the broken sternum bone to ensure it heals well. Along with preventing complications like infection, this is a key to recovery after your heart surgery. The sternum bone will need time to heal. There are surgical stainless steel wires wrapped around it to help stabilize it, but the sternal precautions you will be taught in the hospital will help it heal properly.
Hello, my name is Justina, and I'm a physiotherapist at the Heart Institute. Your surgeon will want you to follow one of two streams for sternal precautions after your heart surgery based on your risk factors. For standard sternal precautions, don't push, pull, or lift more than 10 pounds with your arms for 8 weeks after surgery. After your period of sternal precautions is over and you are healing normally, you will be able to go back to unrestricted mobility as directed by your healthcare team at your follow-up appointment. For modified sternal precautions, don't lift, push, or pull more than 10 to 20 pounds with your arms for 6 weeks after your cardiac surgery. This is to ensure that the sternum bone heals properly. As long as you keep your elbows and hands close to your body, you'll be able to use your arms to get up from a chair, get out of bed, or lift your small dog, for example. After your period of sternal precautions is over and you are healing normally, you'll be able to go back to unrestricted mobility as directed by your healthcare team at your follow-up appointment. If you need to cough or sneeze, cross your arms over your chest and hold yourself tightly like this to protect your sternum. Patients who undergo a minimally invasive surgery through an incision on the right or on the left side of the chest will be able to move around freely without restrictions. You may be able to return to work and driving sooner. You can discuss this with your surgeon. The patient guide includes gentle exercises that will help ease pressure in your shoulders and back. You should do them as directed as long as they don't cause pain. After your surgery, you may notice some slight shortness of breath. Performing your deep breathing and coughing exercises regularly will help open up your lungs after surgery. This will also help dislodge mucus from your lungs. Here's how to do them. Sit up tall in a chair. Take a big, deep breath in through your nose and try to fill the bottom section of your lungs with air. Then, release through your mouth as if you were blowing out candles on a cake. Repeat 10 times. Support your incision by crossing your arms over your chest and cough twice. For the first 6 weeks after you're discharged, do these breathing exercises every hour while you are awake. If your shortness of breath becomes worse at home but is not an emergency, please call us that day. It should get better slowly. The physiotherapist will give you a personalized walking program before you are discharged. You'll be able to find it in your patient guide. You will need to follow this program until you begin your cardiac rehabilitation program. It's important to ensure you are doing your exercises after your surgery to help your circulation, decrease the risk of blood clots, and to help decrease fluid buildup in your body. Remember that it is normal to feel tired after surgery. Take it one day at a time. Cardiac rehabilitation. Attendance in a cardiac rehabilitation program can reduce the chances of being readmitted into hospital by 31%. It will also help reduce your mortality by 25%. You should expect your cardiac rehab follow-up about 6 to 8 weeks after your surgery.
After you're discharged, you may experience some of the following common situations. You may need to take blood thinner medications after your surgery. Atrial fibrillation is an irregular heart rhythm that can be quite common after surgery. You may notice that your heart rate is irregular, or you may feel it beating irregular. Atrial fibrillation can be associated with increased risk of blood clots that may lead to a stroke. If you develop atrial fibrillation, you may be given a blood thinner to reduce the risk of stroke with this rhythm. The blood thinner will be reassessed at your follow-up with your surgeon based on your heart rhythm. It is possible you may not need to take them for a long time, but you should never stop or change anything without discussing this with your healthcare team. There are different types of blood thinner medications. If you are prescribed a direct oral anticoagulant, such as apixaban, Eliquis, Xarelto, or rivaroxaban, you will not need to get your blood work checked to manage your blood thinner. If you are prescribed Coumadin or warfarin, you will need to get your blood work done. This blood work is called an INR level, usually twice a week for the first few weeks. This will allow us to check to see if the dose you are taking is working for you or not. Your surgeon's office should receive the results and will call you if you need to adjust your medication. If you have had a mechanical valve surgery, you will need to take Coumadin for life. It is a life-saving medication. If you are on these medications, please look in your patient guide for more information, including side effects to watch out for, like increase in bleeding. Example, you may bruise more easily. Fatigue. Feeling tired after your surgery is normal. Your body will be using its energy to heal. As a result, the regular activities of daily life, like having a shower, can make you feel tired. You may need to have a rest afterwards. It can take up to 2 to 3 months or longer to really get all your energy back and to really fully heal after your surgery. Try to be patient and take it one day at a time. Give yourself the space to heal. Build your strength back up slowly. Keep doing your exercises to ensure you are getting stronger and increase them slightly each day. If you overdo it, you will feel it. It's a balance. You can follow your exercise program the physiotherapist wrote out for you in your patient guide. Difficulty sleeping. After surgery, some patients report some difficulty sleeping at night. If you have trouble sleeping at the hospital, you may also have trouble at home. However, once you are out of the hospital and in the comfort of your home, this usually does improve. It's important to try not to nap too much during the day. If you do nap, aim for less than an hour and not too late in the day. Also, be careful with the caffeine in coffee and caffeinated teas later in the day. Try not to consume them after 12 o'clock noon. During the first 4 to 6 weeks, you will be able to sleep on your back or very slightly on your side. Make sure it's just a slight turn to ensure you protect the sternum if you have a chest incision. If you wake up at night with pain, you can take some pain medication before you go to bed. Pain and discomfort. If you have pain in your first few days at home, use Tylenol as directed on the bottle or your prescription if you're not allergic. Do not exceed the maximum daily dose. It's important to take your pain medication regularly as needed. You should take pain medication when you start to feel uncomfortable, so it does not become worse. This will help you do the daily activities which enable healing after your surgery. If you still have pain after taking Tylenol, you might be given a stronger pain medication. If so, this will be included on your prescription before you leave the hospital. Right after surgery, you will need to avoid anti-inflammatory medications for pain. Example, Advil, ibuprofen, or Aleve, unless they're prescribed by your healthcare team. They can interact with other heart medications and can also be hard on your stomach. Constipation. It's common after surgery to be constipated. It can also be a side effect of your medication. Make sure to eat regularly. Constipation can be caused by not eating enough. Walking helps too. Choose foods that are high in fiber, such as whole grains, whole wheat, multigrain, flaxseed breads, high fiber cereals, whole wheat pasta. Eat a serving of vegetables and fruit at every meal. Drink at least 6 to 8 cups, 1.5 to 2 liters of fluid of water per day. If you are on a fluid-restricted diet, follow your guidelines. If you don't have a bowel movement for about 2 to 3 days, you can ask your pharmacist and/or your family doctor to recommend a possible medication to help. Mild shortness of breath can be normal. After you get home, it should not be worse than what you experienced in the hospital. Continue your deep breathing and coughing exercises to help expand your lungs and help your breathing improve. If you have an increase in shortness of breath, please contact us. Hot flashes can also be normal after surgery. A fever, however, is not normal. A fever is 38 degrees Celsius or higher, measured with an ear thermometer. If you develop a fever, you will need to contact us or go to the emergency department if you're unwell. Forgetfulness or difficulty concentrating is common after surgery. You will need to give yourself extra time to accomplish tasks and ask for help if you need it. Mood changes. Most patients recover emotionally from cardiac surgery very well, but some people can experience mood swings during recovery, including feelings of anxiety and depression. Common signs of emotional distress include mood swings, difficulty sleeping, feeling overwhelmed, depression, anxiety, or crying for no apparent reason. If symptoms like these develop, talk with your family doctor about accessing support in your area. As well, the Heart Institute will be able to support you through our cardiac rehabilitation program with resources. For some of these programs, your caregiver will be invited to participate in recognition of the impact your challenges can have on your relationships. The contact information for the cardiac rehab team is in your patient guide.
Hi, I'm Joanne McNeil. I'm a dietitian at the University of Ottawa Heart Institute. Today we're going to talk about what to do when you're not feeling hungry. So sometimes after surgery, your appetite can decrease and you might not feel hungry. It's very important to eat well after surgery, especially protein, so even if you're not hungry. This can help your incision heal and can decrease your risk of infection. Here's some tips to help if you have trouble eating. Eat smaller amounts but more often. Try eating every 2 to 3 hours, so that's about 5 to 6 small meals throughout the day. Eat more when your appetite is the strongest, like in the morning time. And make every bite count. Eating half of a meal or 2 to 3 tablespoons is better than nothing. So some ideas for nutritious snacks include whole grain crackers with peanut butter or hummus, a piece of fruit with some cheese, maybe some frozen berries with granola and plain Greek yogurt, or an egg, chicken salad, or a tuna sandwich. Even a half a sandwich is great. Try milk or milkshakes, maybe some yogurt beverages, or an oral nutrition supplement like Ensure or Boost, instead of low energy fluids like water, broth, tea, or coffee. Have easy to prepare meals and snacks on hand when you don't feel like cooking. Some good examples are granola bars, some nuts, some Greek yogurt, maybe some pudding, and cheese and crackers. Have fats and oils at each meal. Top your salads, vegetables, pasta, or rice with a few teaspoons of oil, such as olive or canola. You should also spread margarine or butter on your bread, your vegetables, and potatoes. This will increase the energy content of your food. Avoid reduced fat foods, such as foods labeled light, low fat, or fat-free. Try adding some powdered milk or even some protein powder to your soups. Breakfast cereals, maybe your puddings or your scrambled eggs, for extra protein. And if your appetite doesn't come back or you continue to lose weight, let us know and we'll refer you to a dietitian.
After surgery and discharge, some patients may need to keep an eye on fluid buildup in the body. This is for patients with a history of heart failure or those who have had a valve replacement or repair surgery. You will need to weigh yourself every morning before breakfast. Use the same scale and wear about the same amount of clothing every time. Write your weight down in the Surgery Weight Tracker tool calendar. If you're in the green zone, you are not gaining weight. You do not feel swollen, you're not experiencing shortness of breath or chest pain. Your symptoms are under control. If you move into the yellow zone, you may see a weight gain of 2 pounds in one day or 5 pounds in 1 week. You may have an increase in coughing and shortness of breath. You may also wake up at night with shortness of breath. Your medications may need to be adjusted. Call the Heart Institute that day to speak with your surgeon's office or the nursing coordinator to prevent an emergency in the future. In the red zone, you are short of breath and feeling unwell. You may be wheezing or feeling a tightness in your chest, even at rest. You need to sit in a chair to sleep. You may feel confused or disoriented. In this situation, you will need to go to the nearest emergency department. Don't be nervous if you feel all of this information is a lot to remember. Our cardiac surgery discharge tool will give you an easy to follow checklist of everything you need to do.
Hi, I'm Kim Twyman, a diabetes nurse at the University of Ottawa Heart Institute, and we're going to talk about diabetes before and after surgery and why it is so important. If your pancreas is not producing enough insulin or your body is not using insulin properly, an abnormal amount of sugar or glucose can build up in your blood instead of being used for energy. Insulin is the hormone that unlocks your cell doors so that they can use glucose, the fuel for our bodies. Excess glucose in your arteries can contribute to blockages that can cause damage throughout your body. All patients admitted to the University of Ottawa Heart Institute are screened for abnormal glucose using a non-fasting blood test called hemoglobin A1C or HbA1c. This test measures the amount of glucose that has stuck to the hemoglobin in your red blood cells. This level is a good indicator of your average blood glucose over the past 1 to 3 months. This test is not just a diagnostic tool, but a way for you to know how well you're controlling glucose. The lower the number, the lower your risk of complications. It's important to know your number. About 60% of our patients have abnormal glucose in their blood, and 25% of them don't even know. A hemoglobin A1C less than 6% is the non-diabetic range, which means you are well controlled. Keep up the great work. A hemoglobin A1C between 6% and 6.4% indicates you have prediabetes. You need to take steps including healthy eating and increased physical activity to delay or prevent type 2 diabetes. A hemoglobin A1C of 6.5% or higher indicates you have diabetes. When you have diabetes, you need to keep this number below 7% to decrease your risk of long-term complications. Heart disease is the leading cause of death for those living with poorly controlled diabetes. After your surgery, you will want to have the best glucose control possible to decrease your risk of infection and to promote healing. If you don't have a diabetes team, we can consult with you by phone to help you improve your glucose control. Just give us a call. During your hospital stay, you may meet with an inpatient diabetes nurse who will work as part of your team to ensure you have the best possible glucose control. If you have prediabetes or diabetes, you will be referred to a community diabetes education program for post-discharge care. This will be arranged close to your home where you can meet with diabetes educators one-on-one or in group sessions to learn more on how to manage this progressive disease. If you have diabetes and your hemoglobin A1C is greater than 7%, you will be referred to our diabetes clinic in the Heart Institute. Post-discharge, if you don't have a diabetes team, you will be monitored by an endocrinologist and a diabetes nurse educator. Our diabetes clinic offers a 1-year intensive management program that ensures you receive the correct medication to get you to target before you are discharged, along with a detailed diabetes management plan you will follow with your family doctor. Our automated telephone system calls you regularly for up to a year to ensure you are following the best possible management practices. If needed, our diabetes educator will follow up with you by phone. Our diabetes nurse educators are available for in-person and phone counseling until you start working with your team in your community. It is very important, if you have diabetes, to check your blood glucose at home regularly and to not ignore any high glucose readings. Sometimes after your surgery, your glucose can be elevated due to the stress from surgery. If you develop a glucose reading above 10 millimoles per liter or below 4 millimoles per liter, call your diabetes team that day. You can also call the Heart Institute at 613-696-7000 to connect with our diabetes team here. Keeping your glucose controlled will decrease your risk for infection and help you heal.
Your nurse will review your medications and prescription on the day of your discharge. After you fill your prescription, on the way home from the Heart Institute, it's very important to not miss any doses. If you are taking any medications before you come into the hospital, your pharmacist will review them and help you organize them so you can take them safely. The medication chapter in your patient guide has helpful information on common medications after heart surgery. It will briefly explain why you may be on these medications and include some common side effects to look out for. It's important for you to understand your medications. Before taking any over-the-counter medications, including natural and organic items, ask your pharmacist to check to ensure there are no negative interactions with your heart medications. If you have trouble remembering when to take your medications, speak with your pharmacist. They can help set you up with a system that keeps your medications organized. Usually, your prescriptions will be for about 3 months, but it does not mean that you stop all your medications after this. You will need to renew your medication. Your family doctor can renew your prescriptions in the future. Give yourself at least a week or 2 to renew your medications so you do not run out. Never stop or change a medication without first speaking with your healthcare team. If you need help with your prescription costs, you can talk to a social worker at the Heart Institute about programs that may be able to help you out. Here are some general additional guidelines following your heart surgery. Driving. If you have a sternal incision, we recommend that you do not drive for at least 4 to 6 weeks after your surgery. If you have a minimally invasive surgery through either an incision at the side of your chest or underneath your breast or your pec, we recommend you do not drive for at least 2 weeks. However, only your surgeon will be able to let you know when you can drive again at your follow-up appointment. Your follow-up appointment with the surgeon will usually be about 6 weeks after you are discharged. The surgeon's office will call you when you are home to make this appointment. Your family can drive you to your appointments, and you should wear your seatbelt when you are in the car. If you are driving for more than an hour, get out every hour and move around to keep your circulation moving well. This exercise also helps to ensure you do not develop any blood clots. Working. You will likely be off work for about 2 to 3 months, give or take, after your surgery. It depends on what kind of surgery you will be having and what you do for work. If you need a letter for your work or for insurance, your surgeon's office will be happy to help you out. You can call their office for this after you are discharged. At your follow-up appointment about 6 weeks after your surgery, you can discuss your return to work with your surgeon. Activity. Your exercise and daily walking program will be outlined in your Recovery from Surgery patient guide. Walking is one of the best things we can do for both our physical and mental health. Gradually increase your walking. You can use the physiotherapy discharge video to guide you through some of these exercises to build your strength. Nutrition. Good nutrition can help you heal after surgery, especially protein. Eat healthy, balanced meals to support your recovery. This can improve your outcomes and prevent infections. If you're not eating, please reach out to us. Travel. If you're thinking about traveling in the future, talk to your healthcare team and your insurance provider before booking to confirm eligibility. Sexual health. There aren't any clear guidelines as to when you can return to sexual activity after your heart surgery. Generally, you can resume sexual activity when you're able to go up 2 flights of stairs comfortably. If you have a sternotomy, which leaves an incision down the center of your chest, usually it can be about 4 to 6 weeks after your surgery, but make sure you protect the sternum bone and listen to your body. Please speak with your healthcare team if you have any questions regarding this time frame. If you're taking any medications for erectile dysfunction, please speak with your healthcare team before resuming them. Once you are able to go home, you will receive automated telephone check-ins from us. These calls will ask you general questions on how you're doing. A nurse will call you back if there are any questions regarding any of your answers. This is just an extra check. If you have any concerns after you're discharged, please call your surgeon's office or the nursing coordinator that day. You will have a follow-up appointment with your surgeon about 6 weeks after your surgery. The surgeon's office will call you within about 4 to 6 weeks after your discharge to set up this appointment. You should call and make an appointment with your family doctor within about 2 weeks after you're discharged. Make an appointment with your cardiologist within about 3 to 6 months after your surgery. If you don't have a cardiologist, your surgeon will refer you to one after your follow-up appointment. By far, most patients are able to return to normal life after heart surgery. Prevention is secure. By making changes to your modifiable risk factors, you will be doing what you can to prevent further heart problems. Take the following steps to reduce your risk associated with heart disease. Try your best to eat a balanced diet, do regular exercise, manage your diabetes if you have diabetes, avoid smoking, avoid excessive alcohol, try to manage your stress, manage your blood pressure, your cholesterol levels, and know your risk factors, including genetics. Understand your medication, have regular follow-ups, and of course, investigate any new symptoms with your doctor. Quitting smoking can be very difficult. Smoking before surgery and after surgery can significantly increase your risk for wound infection and lung problems after surgery. You can contact our smoking cessation program to help. Focusing on stopping smoking just 4 weeks before and after your surgery will help improve your outcomes. The contact information for our Stop Smoking program is on our website and in your patient guide. Alcohol. We recommend heart patients to not drink alcohol. If you do drink, it's important to understand ways to reduce your risk of long-term impacts to your heart and overall health. Less alcohol is better and reduces your risk. Do you have any questions or concerns about your surgery that have not been answered yet? If so, you can call your surgeon's office. If it's off hours, you can call the surgical nursing coordinator at 613-696-7000 extension 0. Again, if there's an emergency, call 911 and go to your nearest hospital. You can find additional resources to support you through your healing journey on the University of Ottawa Heart Institute website and in your patient guide. If you are not signed up yet, you may want to sign up for Epic MyChart. This gives you access to your personal health and medical information. You can access your MyChart using your computer, your tablet, or your mobile phone by downloading the app. Some of its features include seeing upcoming appointments, past test results. As well, you can enter your own personal information to keep your file up to date.
Women at Heart. The Women at Heart program is part of the rehabilitation programs offered by the Heart Institute. It is led by women with heart disease for women with heart disease. You can find more information about this program on our website. Participation in rehabilitation for all patients can reduce the risk of being readmitted to hospital by 31%. But women are only half as likely as men to attend the program.
This concludes our presentation today. We are here if you have any questions. Thank you for joining us.